So hello, we're here in Los Angeles in a really nice environment, and I'm so happy and excited to be here with my good friend and long-term colleague, Dr. Tomaso Vercellotti, Professor Tomaso Vercellotti, who is well known for all his innovations, his publications, and especially for the innovation of Piezosurgery and Mectron. Tomaso, welcome to Los Angeles.
Thank you so much. It was a pleasure to come here, and congratulations for your Congress and your institute.
Thank you.
I was impressed.
You're Italian.
Yeah.
So of course you must have had a fantastic summer. What did you do this summer?
In the summertime I went with my family, with 5 grandchildren in Sardinia. For 1 week together, and then I had to return at home because some problem in family, but it was a fantastic summer.
Summer, okay. Yeah, I love Sardinia too. I love Maddalena, the area.
We went not in Maddalena. I was used to go there with the boat for many years, and now we went in Santa Margherita di Pula, in fantastic beaches for the kids. It was outstanding.
Yeah.
In a house in front of the
water.
The water.
Yeah. So now, of course, we have to talk a little bit about dentistry.
Yeah, please, if you like.
So, when I look at some of the work you do to some of the work I do, I see a big difference, mainly in the use of piezosurgery, let's say the application. In my practice, I use piezosurgery like probably every day, but it's more specific. And I want to understand from you, because when I see your presentation, you use it all the time. So what is the reason for that, and how has this developed?
The reason is that the piezosurgery offered to me the possibility to have a maximum surgical control. And it's so safe that I use everywhere. For example, if I had to finish one tooth preparation, I know prosthodontist, but maybe just to put a crown, just to do the finalization, if you do with piezo, you prepare perfectly. Then the extraction, all the surgery, so the osteotomy, the implants preparation, everything, because I start to think microsurgically with piezosurgery. This is the main differences. And the second one is the healing response that is impressive.
Mm-hmm. Okay, so maybe what I have to do, I have to start to expand and understand that piezosurgery is really minimal invasive, less traumatic, maybe less pain, less discomfort.
Absolutely.
And start to expand a little bit.
In all the study that we made, in which we measure the pain, the number of painkillers assumed by the patient, with piezosurgery worldwide, even for the third molar extraction, even for implants preparation, even for the new implant, Wedge implant, the reduction of the morbidity of the patient, one of the best. And the quality of the tissues even, because now raising the flap using piezosurgery make the differences. You saw the color of my gum just 1 day after surgery.
It's interesting because I have an instrument with Ufridi, which is, we call it the Joe 1, like Jovanovic 1, but it's the same thing. It's like a back action chisel. I used to elevate the flap, and obviously it has a chisel to expand the incision. And I'm noticing when I see your piezosurgery, it's almost like a back action, and I'll try to use it.
I tell you which is the main difference that we discovered. From a histological point of view, you observe one increasing number of osteoblasts in the surface of the cortical, and one unbelievable and comparable number of fibroblasts into the endosteum. From a clinical point of view, you see pink color, no swelling, and no pain. And so it's very effective. It's not so easy at the beginning because you need to do a very fine incision in order to make the possibility to engage immediately. If you don't do that, maybe at the beginning it's not so comfortable, but it's sufficient, like any technique, to do in the proper way.
Yeah, that's good. Yeah, so what I probably will immediately look at, and I'm going to enjoy this, is the flap elevation. Yeah. Because I never do that. And secondly, I'm going to start looking at more indications for it.
For example, the concept of the flap elevation is the same when we raise the Schneiderian membrane into the sinus, because in the meantime in which we made in a safer way the elevation without risk to perforation, we make the activation of the cell, because the ultrasonic vibration go directly into the mitochondria to increase the energy of the cell. And this is now there is a lot of study that demonstrate that, but if you work clinical, then become every day better and better and
so
better.
maybe for like bone regeneration, like I do guided bone regeneration, this is a like almost like a biological foundation that we can start using.
Absolutely.
Okay, well then I saw then also like, you know, a revolution. I mean, you know, I've used Nobel implants for many years. I've used, of course, Straumann implants now for many years, and you know, we play with bone level, we play with like tissue level, but in principle they're all like cylindrical and have a different thread pattern. Now I don't know what you are doing, but like now of course you're giving us a new innovation, a new revolution that I'm a little bit, I have to think about it. Like you're almost like pushing me a little bit now to what am I going to do with this. So what is your thinking process behind this? Because we're almost like we're going back to where we started when we had the blade implants, but now we're using piezosurgery to be very atraumatic, a wedge to be minimal invasive. Do you see this as a big revolution?
I start to think in a basic way. I saw that the ridge is rectangular and the traditional screw implant has a circular section. It doesn't make sense because there is the risk to have the essence because there are not this discrepancy in dimension between the screw and the ridge is sufficient to see the literature is important. So the possibility to have a rectangular shape implant exploit the anatomy in a proper way. And this is my first concern. The second one is to exploit, to have the possibility to install the implant without additive bone augmentation procedure, even in many situations in which the majority of the doctors worldwide install the implant and then they have the perimplantitis. And the perimplantitis is the tsunami of our job now. So I want to make the prevention of the perimplantitis instead of the treatment.
Okay, well, I mean, this is incredible. I think we're going to see the industry react to this here. What do you think the implant industry is going to say? What are they going to say? Like, you know, let's say Straumann, Nobel, all these companies.
At this moment, I suppose, because nobody asked me nothing, they are looking just to see what happened. What I think that when you talk about the industry, is some of them doesn't move in this direction. For the future, it will be delayed because. You know, the innovation could be a future or not. But now, after 15 years and a lot of follow-up, I'm certain that it is not, because I was so afraid at the beginning that the result was not satisfying that I never show anything to anybody. But now I have a lot of material that is time to do. Unfortunately, it's not so easy for the colleague to start to do because it's a new paradigm. And every time that you introduce a new paradigm, it means to abandon the old paradigm in which you are used, also the nurses, to use the abutment, to use everything. But this is really outstanding.
Yeah, and then like the wedge implant is, as I understand you, is like tissue level and bone level.
Yes.
Is it correct that you're probably using more bone level than tissue level?
No, it depends, because when the ridge is too thin in the mandible, in which you don't have aesthetic demanding, even if I show unbelievable cases, even because it depends about the soft tissue thickness. But the soft tissue thickness is fundamental even to avoid any vertical marginal bone loss. For this reason, it's so easy that when I raise the flap, I measure the thickness, it's just 2.5, I flatten in the ridge 1 millimeter, I obtain 3.5, and then I have good emergent profile and no bone resorption. So I found so many tricky things in this year, thinking every day about it, that now I think that it was possible to simplify the majority of the treatment.
Good.
Not the most aesthetic demanding, because if you have a gum smile and you lose a bone, it's better to do GBR, of course. But limiting the GBR in the hands of a doctor that are able to do, compared so too many GBR in a socket preservation not well done, that become periimplantitis.
Okay. So maybe a last question. You know, you've been in the career for a long time.
Yeah.
I've been in the career for a long time. What motivates you still to keep innovating, to keep going? What is the drive in your career?
It's a difficult question because it depends on my character. Because I like to do a lot of things. And I like to measure myself every day, and this is very hard. And
are you a perfectionist? Are you a perfectionist?
Yes. When I was younger, I was used to go to washing car, and when I start to wash my car after. So, but the other things is that, like any job, when I start to invent Piezosurgery, then the process of inventing to do better with engineer, with biologists, with histologists, become a normal way to think. I learn a lot from many good persons that I have the lucky opportunity to meet in my life.
Yeah.
And so I'm lucky, man.
Good. So I look forward to see you soon again, and either in California or in Italy. I prefer in Italy, but it's okay. You can come to California.
No, maybe we switch.
We switch.
I appreciate. I'd like to say thank you so much.
You're welcome.
Because now is the time to start maybe a collaboration that could be advantage for both.
Yeah.
I hope.
Tomaso, thank you so much. And,
thank you for the invitation.
Of course, like a safe travel, and I know it's in your life. It's not easy to join us with the time, but I appreciate it.
Thank you so much, Sasha.
Okay.
Thanks. Thank you.
Thank you.